Hello friends, in today's video we are going to see certain important questions from the university papers, and I've tried my level best to give the solutions to all the questions, and I've divided the questions based on the units. And so these are the questions I've taken from the question papers, from the university question papers. I'm going to give the answers along with the questions, and you will see in a part-wise videos. So let us see. Friends, I've shown you the question papers from this university typed questions from the university papers. I've combined it and I've divided it according to the unit wise into 2 marks, 5 marks and 10 marks questions. So first we will see unit wise question and answers. So this is for QP code 1771. Okay. So these are the questions that is repeatedly asked in the question papers. So let us see what are the questions. This is from unit 1. So the first question is, define a midwife. So I've given the answer here. A midwife is a person having been regularly admitted to a midwifery educational programs, but it should be from a recognized university, and then the midwife should be successfully completing the course in that particular university. And if at all she wants to practice in midwifery, she has to have a license and she should be registered to practice as a midwife. So this definition was given by International Confederation of Midwives in 1992. So the second question is, define family-centered care. So family-centered care is broadly defined as promoting the partnership between the parents and healthcare professionals in care of the child. So we are trying to involve the parents in the healthcare when we are taking care of the child and for themselves. So that is called as family-centered care. Next question. Define maternal mortality rate. Maternal mortality rate is defined as death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of duration and the site of pregnancy. Means any death which is caused to a woman during pregnancy, or can be a reason of pregnancy, or it can be because of a termination of pregnancy within 42 days of the termination, we call it as maternal mortality rate. So it is usually given in this rate, that is total number of female death due to complications of pregnancy, childbirth within 42 days of delivery from puerperal causes, an area given during a given year in 2000 divided by the total number of live births in the same area and year. So usually we are going to include the causes that from the childbirth, pregnancy or during the preparing period. If at all, if the mother is the death occurs, then we consider that as a maternal mortality rate. Usually it is multiplied by 1000 and we take the dividing it by the total number of live births in the same area and the same year. So the next question is, define perinatal mortality rate. The perinatal mortality rate is defined as deaths among the fetuses weighing over 1000 grams at birth and who died before and during delivery or within first 7 days of delivery. So perinatal means the name itself is telling you that the fetus death, the fetal death, and but what is a thing? It is considered to be perinatal death if at all if the fetus is weighing over 1000 grams and who will die during delivery or within first 7 days of delivery. We consider that as a perinatal mortality rate, and it is also expressed as per 1000 total births. Next is define stillbirth. So according to WHO, stillbirth is defined as a fetal loss in pregnancies beyond 20 weeks of pregnancies, gestations. Okay, so that means a gestational age should be after 20 weeks or if the gestational age is not known and the birth weight of 500 gram or more which corresponds to 22 weeks of gestation is normally in a normally developing fetus, means if the death of the baby weighing means fetus weighing 500 grams or corresponding to 22 weeks should be considered as a stillbirth. Next is list down preconceptual care. The preconceptual cares, we are going to write out the certain components and coming under the preconception care. Preconception means anything which causes maternal health and wellness. So we are trying to take certain measures to improve the health of a woman before pregnancies. So these are the things that comes under the prenatal care, that is a risk assessment. We are going to assess whether the mother is at risk of developing any future complications when she becomes a pregnant. Health promotion, medical interventions if at all she is having any medical illnesses, and psychosocial intervention necessary here. So friends, these are 2 marks questions asked from the first unit, and in the next forthcoming videos we will see the 5 marks question and 10 marks question. Next one is define neonatal mortality rate. Neonatal mortality rate is any death which occurs during the neonatal period. What is neonatal period? Neonatal period is from the birth to 28 days. We call that a baby as a neonate. So any death which is occurring within this duration, and it is usually taken in terms of total live births in the same year in 2000 will give the neonatal mortality rate. So next question is define maternal morbidity. So any conditions which is making the deviations of the mother's health physically or psychologically during pregnancy or childbirth and the postpartum period up to 48 days of delivery is called as maternal morbidity rate. So in this definition we are saying any departure, subjective or objective, from a state of physiological or psychological maternal well-being during pregnancy, childbirth and the postpartum period up to 42 days of delivery related to changes taking place in these periods. Next question is mention 4 ethical principles in obstetrics. So here we are seeing certain ethical principles related to obstetrical nursing. That is, first one is autonomy. Autonomy means the right to self-determination. Beneficence means obligations to do good. Means we are trying to do certain good things for the patients. And non-maleficence means trying not to do harm. You're not going to harm anyone here. Justice, equal and fair treatments means we should give our time and service equally to all kinds of patients irrespective of anything. Next one is fidelity. It is faithfulness or trying to keep up the promises. Next one is veracity, is being truthful, trustworthy and accurate. Next one is utility. So you can select any of these 4 things and you can write. So what is utility? It is a good for an individual. It means when we are trying to do something, some good work for some individual, it comes under the utility. Next, they've asked us the causes of neonatal mortality. Usually the causes goes like this, and the percentage has been already given by WHO. For causes preterm birth complications 35%, complications during birth 23%, sepsis, meningitis or tetanus 15%, pneumonia 11%, congenital abnormalities 9%, diarrhea 2%, and other conditions 6. So these are the common causes of neonatal mortality rate to increase. Next, they have asked us define total fertility rate. So here total fertility rate is the average number of children that would be born to a woman by the time she ended the childbearing. Means it is, we can consider it as a simple way, means the number of women divided by total number of birth into 1000 will give the total fertility rate. So next question was list down the maternal morbidity causes. Means here they ask for the causes of maternal death and morbidity. So here it is because of severe bleeding, infection, eclampsia, obstructed labor, unsafe abortions, and other direct cause and indirect cause. Direct cause, indirect cause related to pregnancy, childbirth, and fufarium. So these are the things that comes under the causes. So you can see the percentage divided accordingly. Okay, so we have seen 2 marks questions from the first unit. In forthcoming videos, you will see the 5 marks and 10 marks questions of the other units also. Thank you for your patient listening. If you like this video, do like, share and comment. Thank you.